Welcome to Advocate Today. I'm Aaron Dean. We want to warn you that the topics that we're going to talk about today are sensitive, but there is help for those who are thinking about suicide. Last year, more people died from suicide in the United States than any other year on record. 49,449 lives were lost to intentional self-harm in 2022. That's according to the latest CDC data. July marked the first anniversary of the new national 988 Suicide Crisis Lifeline. The three-digit code is easier to remember and accessible by text, which has become a preferred form of communication for many. In the first year, it received 5 million calls in text, but more than 80% of adults say that they are unfamiliar or had never heard of 988. Dr. John Palmieri is a senior advisor for the Substance Abuse and Mental Health Services Administration. He played a key role in the change over to 988 and says mental health should not be taboo. Dr. Palmieri, welcome back. Thanks so much.
Thank you so much for inviting me. It's a pleasure.
Yes. Now, for our audience, if you can kind of refresh their memory a little bit, but you provide a little bit of background on the work that you were doing at the Substance Abuse and Mental Health Service Administration?
Yeah, thank you. So I am part of the 988 and Behavioral Health Crisis Coordinating Office at SAMHSA, and we are the federal agency that's been designated to lead the implementation of 988 nationwide. For those of you who are not aware, 988 is the new, easier to remember three-digit code as a portal to access what was the National Suicide Prevention Lifeline. So anybody experiencing any form of suicidal, mental health, substance use distress just has to remember three easy digits, 988, to be able to access life-saving services, be connected to a counselor to address whatever their concerns are and provide ongoing support.
And as we know, September is National Suicide Prevention Month, and you have done work with the 988 platform that was launched last year. What makes the 988 Suicide and Crisis Lifeline platform so essential to aiding in this mental health crisis that we're all in?
Well, some of it is what I just mentioned, which is the easier to remember part, because we know that when people are in distress or in crisis, it's not easy to remember what to do next. What's the most important next step? And having the opportunity to access services through 988 is critically important for anybody when they're in any form of distress. And one of the things that we have been very focused on is increasing awareness of the life-saving services that are available, because we know with a new service, with a new number that's been implemented, as you said, as of July 2022, there's a lot of work to be done to amplify awareness so that people know that it's a service that's available to anybody 24/7 whenever they happen to need support. So that's one of the things that we've been very focused in on. And I would say that we've also been very focused in on making sure that capacity is sufficient to address people when they need the help. Historically, the Lifeline has had struggled with resource challenges, but fortunately, in the past couple of years, there's been unprecedented investment across the federal government and with state and local governments as well to increase resources for the Lifeline so that when people call, chat, or text, they can be connected to counselors quickly.
And if someone needs to call the 988 number, what can they expect? What are the services that are actually available? What will that call look like?
Yeah, well, it will depend a little bit on the nature of the call and the concerns that the person is bringing. But typically when somebody calls or texts 988 or accesses the chat service through 988lifeline.org, they will be greeted by a Lifeline counselor. That person will identify themselves as being part of the 988 Lifeline. And then they'll go into a series of questions or a conversation, really asking the person what's going on, how they can be helpful. There'll be some standardized components to that interaction, including a risk assessment to determine if there are any imminent risk concerns, and then safety planning that goes along with that so that the person understands what the next steps will be with respect to ongoing contact. And then there's usually a referral component. So one of the key pieces of the 988 Lifeline is to try to connect people to local supports, recognizing that it's not just about providing the crisis service, it's also about providing that linkage and ongoing support for people to get follow-up care and support with their recovery and treatment needs in a longer-term basis. So a component of that will also be referrals and linkages to ongoing services.
And as a mental health expert, how can promoting awareness about mental health stigmas aid in the prevention of suicide?
Yeah, so we know that one of the biggest barriers is really that stigma piece, where people are reluctant to seek help because of concern, because of fear, because of shame regarding the help-seeking behaviors. And so one of the things that's been the most promising aspects to 988 has been the way it has amplified the national dialogue on suicide prevention, on crisis care, on access to mental health services. And there have been lots of celebrities, influencers, others who have leaned into that conversation to really let people know that it's okay to not be okay. It's okay to admit that you're struggling. It's okay to ask for help. And so the more that we can do that and amplify that messaging to encourage people to seek help when they need it, that will go a long way in addressing the suicide crisis and other crises that we're seeing in the mental health and behavioral health space in general.
And as we know, when it comes to marginalized communities, we oftentimes see statistics that show that there are higher rates of mental health struggles at times, and even with suicide, particularly among LGBTQ plus youth. Can acceptance and inclusion help improve the mental well-being of these groups?
Yeah, we absolutely know that, as you're saying, that marginalized communities like LGBTQI plus youth, young adults, have struggled with access to mental health services and have struggled with discrimination, stigmatization, access to care. And one of the reasons that we have built specifically a Press 3 option and access to specialized services for LGBTQI plus youth and young adults is so that they know that there's a service that's available to them, a service that they can trust, by counselors who are specifically trained to provide services to that population. We know, as you're pointing out, that this is a community that is at higher risk of suicide. There's been lots of studies and surveys that have shown that. And so we want to make sure that there's both awareness for individuals that the service is available to them, and also that there's trust that this is a service that is for them and that they can be encouraged to contact and feel understood and feel accepted and feel not judged when they present their concerns to the crisis counselors.
And of course, other than like we talked about earlier, breaking down those stigmas and holding conversations like we're having today, how else can we continue to work on normalizing, talking about mental health and well-being?
Yeah, one of the things that we did very early on as part of our 988 implementation through our communications team was to develop a partner toolkit at samhsa.gov/988. So there's a tremendous repertoire and suite of materials there, printable materials, downloadable social shareables, and so forth. And so one of the ways that we see that it's critically important is leveraging the influence and the expertise of our partners to be able to disseminate messaging around 988. So I would encourage anybody to access the website that I mentioned, download materials, share those within your communities, adapt them as you feel like you need to support your local communities, again, to amplify that awareness and that messaging around the services.
Yeah. And of course, to wrap things up, is there any other special messaging or key messages about 988 that you want to share with our viewers?
I would say that we are just continuing the conversation around not only implementing 988 and strengthening response times and capacity building for 988, but also at the same time looking broadly at the crisis continuum and how 988 folds into other services that are going to be necessary when people are in crisis. So whether that's mobile crisis services or stabilization services, again, making sure that we're increasing utilization of the service for those marginalized communities so that they trust the services, that they trust the Lifeline brand, they trust the services, and they utilize those services. So we really are at the beginning of a really incredible shift, I think, in the way that people access care and speak about crisis care, and really excited to be a part of that journey with all of you.
Yeah. And last question, how can our audience interact and participate in Suicide Prevention Month?
Definitely access the samhsa.gov/988 partner toolkit to support dissemination of those materials. SAMHSA also has, along with HHS in general, a series of activities that are being undertaken as a part of the 988 Roadshow. So that has included a number of stops around the country, amplifying the success of 988 and the implementation of 988, and also some of those critical contingency services around the crisis space. Be upfront and talk about mental health struggles to encourage others to do the same.
All right. Well, thank you so much for joining us again. We really appreciate it.
Thank you. It's a pleasure. Good to see you.
September is National Suicide Prevention Month. The 988 Suicide and Crisis Lifeline is using the hashtag #BeTheOne2, a reminder for family and friends to be the one to keep them safe, be the one to ask, be the one to follow up, be the one to help them connect, and be the one to be there. If you or someone you know is struggling with their mental health, you can call the new 988 hotline. It provides immediate help and resources for those in need of it. Again, that number is 988. Thanks so much for watching Advocate Today. I'm Aaron Dean.